Did you know that one state's overdose numbers are off the charts, more than 3 times the national average? And it's not alone. Across the country, unexpected places are facing some of the worst addiction crises. Picture this: communities grappling with skyrocketing fatalities, families torn apart, and resources stretched thin. But which states are hit the hardest? And how do they compare to one another? Stick around as we uncover the surprising regions battling America's most devastating addiction epidemics. The numbers might shock you, but the stories behind them reveal even more about the challenges these areas are up against. 1. Indiana's growing struggle. Did you know Indiana is now grappling with a surge in opioid and alcohol misuse, pushing it into the top 10 states for addiction crises? It's a troubling development for a state that, on the surface, doesn't always come to mind when you think of America's addiction hotspots. Over the last few years, opioid abuse, driven by heroin and fentanyl, has skyrocketed, while alcohol misuse has added another layer to the crisis. What's alarming is how quickly these issues have escalated. Unlike states that have faced substance misuse for decades, Indiana's rise has been swift, leaving little time to adapt. You might expect a state known for innovation in manufacturing and life sciences to tackle addiction with the same efficiency. But instead, it's like a high-performance engine running out of fuel. Indiana's addiction treatment resources are severely lacking. The state has one of the lowest ratios of counselors to residents in the country, leaving thousands without access to the help they desperately need. The existing infrastructure is overwhelmed, unable to meet the growing demand. Take, for example, a hypothetical resident named Sarah. After a car accident, she was prescribed opioids for pain management. When her prescription ran out, she turned to street drugs like heroin and fentanyl, which were cheaper and easier to find. Within months, her life spiraled out of control, and without enough treatment options available, she became another statistic in the state's rising overdose deaths. Stories like Sarah's are all too common, highlighting the devastating human toll behind the numbers. The roots of this crisis lie in years of overprescribing opioids, which left many residents dependent. As prescription pills became harder to access, deadlier alternatives like fentanyl flooded the streets, driving overdose rates to unprecedented levels. How can a state celebrated for innovation fall so far behind in care? Indiana's struggle underscores the urgent need to balance prevention, treatment, and enforcement before more lives are lost. 2. Tennessee's rural epidemic. Tennessee might be famous for country music, but it's also battling a silent epidemic in its rural regions. Over the years, the state has climbed into the top 10 for drug-related issues, driven by the overprescription of opioids and the increasing presence of fentanyl. These substances, often deceptively mixed into other drugs, are fueling addiction and causing fatal overdoses at an alarming rate. In 2021, opioids were involved in 80% of all drug overdoses in Tennessee, a staggering figure that translates to nearly 3,813 lives lost in a single year. Imagine a packed concert hall, its seats emptied by this crisis, year after year. It's a grim reality that underscores how deeply entrenched the problem has become. One of the biggest challenges Tennessee faces is the impact of geographic isolation, especially in rural areas where addiction is surging. For many residents, getting help feels like missing the nearest lifeline by miles. Long travel distances to treatment facilities and a lack of affordable healthcare options leave many trapped in cycles of substance abuse with no easy way out. While the state has expanded access to the overdose-reversing drug naloxone through its Good Samaritan law, which allows citizens to administer the drug and grants immunity from lawsuits, this is only a temporary fix. The real issue lies in the lack of ongoing treatment opportunities for those battling addiction. Fentanyl, a synthetic opioid 50 times more potent than heroin, plays a leading role in Tennessee's rising overdose deaths. It's often illegally added to drugs without the user's knowledge, turning a single dose into a fatal mistake. Combined with the widespread availability of prescription opioids, Tennessee's addiction rates have skyrocketed. This epidemic thrives not just on substances but on persistent socioeconomic issues like poverty and limited public health funding, creating a perfect storm. Tennessee's struggle is a stark reminder of how addiction spreads where resources are scarce. As we turn to the next state, the escalating nature of this crisis becomes even more apparent. 3. Maine's unseen crisis. Did you know Maine, often seen as a peaceful New England retreat, is grappling with one of the nation's most severe addiction crises? Behind its picturesque coastal towns and quiet forests lies a growing epidemic of drug use and addiction that has devastated families and communities alike. The roots of Maine's drug crisis trace back to the overprescription of opioids, which created a dependency pipeline. When prescriptions ran out, many turned to street drugs like heroin and fentanyl. Fentanyl, in particular, has become a deadly force, contributing to 77% of fatal overdoses in 2021. That year, Maine recorded 611 overdose deaths, a stark reminder of how deeply entrenched the problem has become. These numbers aren't just statistics, they represent lives lost and families forever changed. Despite efforts to curb opioid misuse through laws and programs, the availability of these substances continues to fuel the crisis. Socioeconomic challenges compound the issue. In many parts of Maine, poverty and limited access to education leave communities vulnerable to addiction. For one family in rural Maine, the struggle began when a father injured on the job was prescribed opioids for pain. When his prescription ended, he turned to cheaper, illicit drugs, plunging the family into financial instability and emotional turmoil. Stories like this are all too common, illustrating how addiction ripples through households, straining relationships and mental health. Adding to the problem, Maine's treatment infrastructure hasn't kept pace with the growing need. Many residents face long wait times or financial barriers to care. Programs like medication-assisted treatment, MAT, offer hope but remain out of reach for many. Public awareness campaigns and prescription drug monitoring programs, PDMPs, are in place, but their impact has been limited in reversing overdose trends. Maine's crisis mirrors struggles in other states, showing that addiction knows no boundaries. Addressing this epidemic requires not just resources but a fundamental shift in how we approach prevention, treatment, and community support. 4. Ohio's fight against fentanyl. Ohio's overdose death rate once soared to over double the national average. What happened? For years, the Buckeye State has been at the epicenter of the opioid epidemic, with fentanyl, a synthetic opioid far more potent than heroin, driving the crisis. In 2021, fentanyl was involved in approximately 83% of opioid-related overdose deaths in Ohio. Often mixed into other drugs like heroin or counterfeit pills, its potency and widespread availability have fueled a devastating surge in fatalities, leaving communities grappling with profound loss. Ohio has made strides to combat this crisis, but the challenges remain immense. A key initiative is the Prescription Drug Monitoring Program, PDMP, designed to regulate opioid prescriptions and reduce practices like doctor shopping. In 2015, the state enhanced its efforts by integrating pharmacy systems and electronic health records with the Ohio Automated Rx Reporting System, OARRS. This allowed officials to better track prescribing patterns and curb overprescription, a major contributor to the epidemic. While these measures have helped reduce prescription opioid misuse, fentanyl's rise has outpaced these interventions, underscoring the complexity of the crisis. In 2017, Ohio's drug overdose death rate was 46.3 per 100,000 people, more than double the national average of 21.7. This stark figure highlights the state's struggle, particularly in communities already burdened by poverty, housing instability, and limited healthcare access. It's like trying to plug a leaky dam with duct tape. Progress is made, but the floodwaters keep coming. To save lives, Ohio expanded access to naloxone, a drug that reverses overdoses, and increased funding for medication-assisted treatment (MAT) programs, which combine medications with counseling to support recovery. These efforts have provided hope, but fentanyl continues to infiltrate communities, claiming lives and making it difficult to stem the tide of addiction. Ohio's fight against fentanyl reflects both progress and the ongoing struggle to address the opioid epidemic, a crisis that continues to spread unevenly across the nation. While programs like PDMPs and MAT are vital, they reveal how much more is needed to bring lasting relief. 5. Kentucky's overdose epidemic. Kentucky has one of the highest drug overdose death rates in the United States, but why? Opioid-related overdoses are at the heart of this crisis. From prescription opioids to heroin and fentanyl, these substances have driven countless lives into addiction and, tragically, death. In 2020, the overdose death rate in Kentucky was 37.2 per 100,000 people, significantly higher than the national average. Over the past decade, overdose fatalities in the state have more than doubled, with opioids involved in 80% of the 2,381 reported deaths in 2021. The roots of this crisis lie in the prescription opioid epidemic. Companies like Purdue Pharma, makers of OxyContin, misled the public and medical professionals about the addictive potential of their drugs. This led to widespread dependency, and when access to prescription painkillers became restricted, many turned to heroin or fentanyl as cheaper, more accessible alternatives. Fentanyl, a synthetic opioid 50 times more potent than heroin, has been particularly devastating. Often laced into other drugs, it was involved in 70% of Kentucky's fatal overdoses in 2021, making it nearly impossible for individuals with substance use disorders to avoid life-threatening risks. The impact of this crisis is deeply personal for communities across the state. In small towns like Manchester, families have been torn apart as addiction claims parents, siblings, and friends. Stories of children growing up without caregivers or entire neighborhoods grappling with loss illustrate the human toll behind the statistics. Kentucky has taken steps to combat the epidemic. Programs like the Kentucky All-Schedule Prescription Electronic Reporting, CASPR, aim to reduce overprescription, while expanded access to naloxone has saved lives in overdose emergencies. Medicaid now covers substance use treatment, making recovery more accessible. However, a shortage of treatment providers and overwhelmed facilities remain significant barriers. Kentucky's struggle reflects a broader issue: the consequences of misinformation and inadequate resources. While tools like naloxone and monitoring programs have helped, the state's experience underscores the urgent need for comprehensive solutions to address the gaps in treatment and recovery support systems. 6. Louisiana's multi-substance crisis. Louisiana is grappling with a cocktail of chaos, a multi-substance addiction crisis that extends far beyond opioids. The state's drug problem spans opioids, methamphetamine, cocaine, and alcohol, placing Louisiana among the hardest-hit states in the nation. In 2019, the opioid overdose death rate was 13.6 per 100,000 people, exceeding the national average of 10 per 100,000. When all substances are considered, the total drug overdose death rate climbed to 24.6 per 100,000, underscoring the crisis's complexity. One of the most urgent challenges is the lack of access to treatment facilities. Many residents in need of care face insurmountable barriers. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, Louisiana suffers from a shortage of comprehensive treatment services. For example, in rural areas, individuals often travel hours to reach the nearest facility, only to find long waitlists or limited capacity due to underfunding. These gaps disproportionately affect low-income communities where addiction often goes untreated, perpetuating cycles of poverty and poor health. Fentanyl, a potent synthetic opioid, has made the crisis even deadlier. Frequently mixed into other substances without users' knowledge, it has become a leading cause of overdose deaths in Louisiana. Cocaine and methamphetamine also contribute significantly to fatal overdoses, further illustrating the multifaceted nature of the problem. Alcohol misuse compounds the issue, adding to the physical and social toll on families and communities. To address the crisis, Louisiana has implemented several initiatives. The Louisiana Opioid Surveillance Program enhances data collection, equipping officials and healthcare providers with tools to monitor and respond to overdose trends. The Advisory Council on Heroin and Opioid Prevention and Education, HOPE Council, emphasizes data-driven strategies to allocate resources effectively. These programs aim to identify the areas of greatest need and provide targeted support. Louisiana's struggle highlights the intricate web of addiction. With multiple substances at play and limited resources, the state's battle is a stark reminder that solving addiction requires more than policy. It demands action tailored to the unique challenges of each community. 7. Nevada's schoolyard dilemma. Nevada ranks third worst for drug problems in the United States, And what's happening on school grounds reveals an even more alarming reality. According to a 2024 WalletHub study, Nevada has the second highest percentage of students offered, sold, or given illegal drugs on school property. School should be a safe environment for learning, yet many students in Nevada are encountering substances that could derail their futures before they even graduate. This troubling trend places kids at the heart of the state's drug addiction crisis, underscoring how deeply the problem has infiltrated schools. The lack of addiction treatment resources in Nevada compounds the issue. The state suffers from a severe shortage of treatment facilities, leaving many without the help they need to recover. This gap doesn't just affect adults, it also undermines prevention efforts for younger populations. Schools, which play a critical role in educating students about the risks of substance abuse, are left struggling to implement prevention programs due to limited resources. Without these programs, schools become vulnerable, like a fallen shield, leaving students exposed to the growing presence of drugs on campus. The broader picture of unmet treatment needs highlights systemic failures that ripple through communities. WalletHub data shows a significant portion of adults with substance use disorders in Nevada don't receive the treatment they need. Financial barriers, stigma, and long wait times are just some of the factors contributing to this crisis. A shortage of substance abuse counselors per capita further exacerbates the problem, leaving existing facilities overwhelmed and unable to meet demand. When adults can't access treatment, the effects extend to their families and communities, perpetuating cycles of addiction. Nevada's drug crisis illustrates how a lack of counselors and treatment resources creates widespread consequences. Counselors are essential in guiding individuals through recovery, but with too few available, many are left to face addiction alone. This shortage is especially devastating in schools, where inadequate prevention measures leave students vulnerable to early exposure. Addressing these gaps is critical to protecting Nevada's future generations. 8. West Virginia's overdose tragedy. West Virginia faces the highest drug overdose death rate in the nation. How did it get here? In 2021 alone, the state recorded 1,501 overdose deaths, with approximately 83% involving opioids. Fentanyl, a synthetic opioid far more potent than heroin, has become the leading factor behind this devastating statistic. These numbers reflect a grim reality. The opioid epidemic has deeply rooted itself in rural communities, where isolation and limited resources make recovery an uphill battle. Imagine a family in a small West Virginia town struggling to hold on as addiction tears through their lives. The nearest treatment center is hours away, and even if they could get there, it's already overwhelmed. This is the reality for many in the state's rural areas, where a shortage of mental health resources and addiction treatment options leaves people with few places to turn. Social workers and counselors specializing in addiction are scarce, and insurance limitations often block access to care. These systemic barriers make it incredibly difficult for those battling addiction to find the help they need. To address this crisis, West Virginia has received $33 million in federal funding from the Substance Abuse and Mental Health Services Administration, SAMHSA. Programs like Police and Peers, PNP, which pairs law enforcement with peer recovery support specialists, aim to provide immediate support during nonviolent incidents. The funding also bolsters community services for severe substance use disorders and creates programs tailored for young people. While these initiatives offer hope, the challenges of implementation and the scale of the crisis remain daunting. The impact of addiction extends far beyond individuals. Families are torn apart, and children grow up in households marked by emotional trauma and financial instability. Entire communities feel the ripple effects. Addressing this crisis will require more than funding. It demands comprehensive solutions, from prevention campaigns in schools to expanded treatment access. Behind every statistic is a story, a reminder that addiction is a human crisis requiring urgent, compassionate action. 9. New Mexico's teen crisis. New Mexico is ranked as the worst state for drug problems. What makes its crisis unique? It starts with an alarming trend among its youngest residents. New Mexico leads the nation in the percentage of teenagers using illicit drugs, with many starting at shockingly young ages. WalletHub's data reveals that the state also has the highest share of teens trying marijuana before the age of 13. Early exposure to substances like marijuana significantly increases the risk of developing long-term addiction and substance use disorders, setting the stage for struggles that can last a lifetime. This issue is compounded by gaps in preventive systems. For instance, New Mexico lacks statewide employee drug testing laws, leaving a void in workplace policies that could discourage drug use or identify those in need of help. While this may seem unrelated to teenagers, it reflects a broader challenge. The absence of societal oversight makes it harder to regulate or intervene in drug misuse. A school counselor in Albuquerque noted that without strong community frameworks, teens often fall through the cracks, exposed to substances without adequate support or guidance. The urgency of the crisis is evident in New Mexico's rapidly climbing overdose death rate, which is growing faster than in most other states. Fentanyl, a leading cause of fatalities nationwide, poses a significant threat here, compounding the dangers of early substance use among teens. This intersection of rising deaths and early exposure underscores the fragility of the situation. On a positive note, New Mexico has pioneered harm reduction efforts. It was the first state to allow pharmacists to prescribe naloxone, the life-saving overdose reversal drug, without a doctor's prescription. This proactive measure has saved lives, but it's clear that addressing teenage drug use requires even earlier intervention. How can New Mexico break this cycle? The answer lies in prevention. Without targeted efforts to educate and protect young people, addiction can take hold before they even have a chance to build their futures. What steps will we take to ensure they do? So there you have it. America's struggle with addiction is a complex patchwork of crises, with every state facing unique challenges. Yet, there are glimmers of hope. Programs like Louisiana's opioid surveillance highlight the power of data, while Indiana's $506 million settlement underscores the impact of investing in prevention and treatment. Progress is possible, but real change demands a united national effort and resilient communities. What policy shifts or local actions do you believe can turn the tide? Share your thoughts. Your voice matters in shaping solutions and inspiring others to act. Together, we can make a difference.